So my first question for our panel is, how does implicit bias in healthcare settings affect the quality of care for our community, especially when they're trying to receive this care during the pregnancy, childbirth, and postpartum period? No, whoever wants to answer it, speak on it.
Well, I can start by saying that a lot of my patients come to me and are really excited to see that I'm there because in the past, I'm so sorry, their experiences have been that they have been judged from their background, or they're not heard or understood from what they're trying to express to their providers. Sorry, is that better? I'm so sorry. And then when they come, they're afraid that they're not going to be heard. They talk to their providers about their pain is dismissed, and then they're less likely to come and express that they're having symptoms. And it leads to worse outcomes for both our moms and the babies because they're more likely to ignore symptoms, or they're going to delay care because they don't want to be judged for how they present themselves in what's supposed to be a safe space of healthcare.
It also shows up in their training. So my cousin's a OB and became a doctor a few years ago, and some of their literature still says that black people feel less pain. Like there are young doctors that are still being taught this. Not only that, there are assumptions that are made about mothers and families who are on Medicare, Medicaid. They don't get the same quality of treatment in the medical spaces. But not only that, in many areas of practice, they're not used to seeing minority families that are together where the father and the mother are present. And so if the father is advocating for his partner because of her pain or because of her treatment, then he's automatically treated like he's a threat or he's belligerent. And so we've actually had fathers that are escorted out of the room for delivery by security or police because our men are assumed to be a threat. And that's all because of implicit bias.
I think I have to say, as a body worker, one of the things that is not offered is alternative care, massage, yoga, chiropractic care, and these things are like really important to help your baby get into line, but these things are not offered to our community because health insurance do not pay for that. However, I like to say that I work at Dr. Block Family Chiropractic Care in Chesapeake, and we have a program for moms that have Medicaid where you can come and get adjusted for $30, and then you can also get a massage for $40. And this is really great to help get baby into position, which can really help to prevent, when they tell you have to go and, help me, go for your baby before to go in induction. Yes, this helps with the induction. This helps to cut down labor time and things like that. And because these things are not in our community and we don't know enough about it, we are really always the first ones to be put into inductions and things like this.
I would also say that implicit bias shows itself up in policies that run the hospital, and then even the police work that comes in. As he mentioned, that sometimes the fathers are escorted out. Implicit bias shows that, implicit bias being that the negative ideas and perspectives of black and brown families, and also that specific bias that he mentioned about families, black and brown families usually not being a quote unquote nuclear family where there's the mom and the dad that are there for the birth. And these things show up in policy and they make it normal to be able to bring the police officer or the security guard in when the father is showing that he's going to be passionate and aggressive on his partner's safety and her in advocating for her pain to be managed appropriately. It shows up in the policies of the hospitals, allowing for a certain amount of time for white women to labor down, and the annoyance that comes when black and brown women are laboring for what they may consider to be a longer time.
I notice it in the pediatric space, typically where in education. So education about disease processes, education about how your children will respond to medications or how they were treated, perhaps in an emergency setting. A lot of times I'll see kids come into my office and they have been recently diagnosed with asthma. They were just given a bag of medicine and said, okay, follow up with your pediatrician. They don't know how to use the medications. They don't know what other disease processes go along with it. They don't know about the allergic triad and how all these things go together. So it really is about the patients getting the education that they need and that the parents are getting the education that they need, and the implicit bias just made by assumptions, especially if a mother has multiple children. This might be the first one that has this disease process. We can't make those types of assumptions.
All right. So, based on your experiences, can you share either personal stories or anecdotes that highlight the challenges or successes that you've seen addressed in terms of black maternal health issues?
Well, my personal story is what made me get into healthcare. When I was having my baby, I had a white nurse, and I kept telling her, I was like, I'm really uncomfortable. I'm really uncomfortable. And her response to me was, well, sweetie, you're having a baby. You're not supposed to be comfortable. So then of course, that upset my husband, and I started vomiting, and he was like, so please come help my wife. So he went off, right? So now I'm writhing in pain. He cussing them out. Sorry, children. And by the time she comes to check me, I'm like 8 centimeters dilated. And I have went this whole time with her just thinking I'm just making stuff. That's what prompted me to get into this field, although adult healthcare is not my ministry. Pediatrics is where I am, but however, that helped me realize that there is definitely a space for us and a need for increased representation in healthcare. So that is what I am trying to do, being in this space and educating those that look like me and teaching parents how to better care for their children is how I'm helping to navigate and sort of create a solution for mothers that may be in similar situations.
We're Mr. and I talking over each other. I'll say the same thing. Education, but education more so of the system overall or services available. We have kind of been conditioned in the past few decades that giving birth in the hospital is the way to go. So lots of times when people mention that they want to have a home birth, it's associated with, oh, that's dangerous, or why would you want to do that? And especially in the Black community, family and friends' input is very important to them. So if you have many people in your ear telling you it's not safe, then that can steer people away from doing what they really feel is best for them and their family. And the same thing in the mental health population. Things have gotten a little bit better, but there's a stigma attached to having a diagnosis, reaching out to get help. So that prevents people from reaching those services as well. So I think education overall is key to kind of dismantling some of those challenges.
And I'll just tell a quick story of mine. I remember having my daughter. I was in Alaska, and I gave birth to her, and I remember holding her, and it didn't feel what I thought it would feel like. And I was actually just upset. I was mad. I remember telling the nurse, I was like, I don't feel right. And she said, shh, before they put you on the third floor. And the third floor for them was like the Grippy Sock vacation. So, of course, you want to be quiet because you want to go home with your newborn. And I just had a conversation with my partner 2 days ago. I was supporting one of my clients to her appointment, and they wanted to induce her yesterday. Yesterday was made her 40 weeks, and they wanted to induce her. And I'm trying to figure out why she need to be induced, and they just saying because she's 40 weeks. And nothing's wrong with her. She's completely healthy, but you want to induce her. And I'm just grateful to God that I was there to be able to advocate for her. But just those little things like that, I feel like they'll try to, and they were just mentioning things, well, all these things can happen once you turn 40 weeks, and now she's 40 weeks in one day, and she's doing fine. So like she was saying, education, but if they're doing that to that one person, there were 10 other moms in the waiting room. So what are you telling them?
A win, what I've seen, my oldest daughter's about to be 18 on Wednesday. And I remember, this is before I had any kind of education toward fatherhood and what women went through during the pregnancy process and postpartum. But my wife experienced postpartum depression. And we were fortunate. I knew something was wrong. Well, I don't know if wrong is the right word, but I knew something was different from how she felt even during the painful labor experience and prior to how she felt immediately after my daughter was born. And she just didn't look and sound like my wife. And so I was able to talk to the social worker and say I have some concerns. And they were very supportive in terms of information and support in the hospital, and actually allowed us to stay in the hospital longer because, they rush you out immediately after with this new baby that I have no idea what I'm doing with, and a wife who doesn't want to hold or kiss or touch the baby at all. And so I think since that time, it's gotten better in terms of the support that's offered in the hospital for a birthing person who might be showing the signs or symptoms of what might be later diagnosed as postpartum depression. I know that's not everybody's experience. The majority of the people that I know have actually not had that experience. So I know it's not great, but from what I've seen, it's gotten a little better.
I was just going to add that one of the things you want to do is know your rights, Latika. Know what your rights are. Know that you have a voice and feel empowered when you go in. Because not all stories are like these trauma, bad stories, right? So if you go in and you're empowered and you know your rights and you have your doula and you have your OB or your midwife that you can kind of go to and talk to and say, hey, listen, yeah, I had a C-section with my first baby, but this baby, I don't want to have a C-section. I want to try for a VBAC. And tell me why I can't have a VBAC. Not just that that's the norm, because that's what you did for her, does not mean that that's what's right for me. Give me the reason as to why I cannot. Know your rights, know you have a voice, and go in empowered, and everything will be okay. Oh, and a VBAC for those that don't know. And then so that we know that this is true, my first baby, who is 35 years old, was a VBAC, and I went on to was a C-section, and I went on to have 7 VBACs after that. So VBACs are possible, and don't let anyone tell you that you cannot do it. Vaginal birth after C-section is a VBAC.
Yes, yes. All right. So I love just when you talked about those rights, there is, if you have not picked up a flyer, it's the Black Birth and Bill of Rights, and it teaches you the things that you should be able to advocate for yourself. Everybody, I don't care if you're black, brown, green, or purple, you should know what your rights are. You should have providers that speak to you, whether it's a lactation provider, your OB, your midwife, whoever it is, they should be accountable to you. You are not accountable to them. You are the consumer. You are the person who is getting the care. And so when you reframe your thinking to say, wait a minute, it should be about me at this time, instead of somebody talking down to you, they should be speaking with you. With that being said, so I want to know, can you give some advice on when people should start looking for their providers? Whether if they're pregnant, when should they start looking for a pediatrician or lactation? Or before they're even pregnant, when should they start looking for someone to provide their prenatal care? And how should they go about doing that?
So for me, I would say as soon as you all are considering having a child, to begin to look like don't wait. I have a dear friend who has epilepsy diagnosis, and so the medication to treat epilepsy is very harmful during the pregnancy. Something as simple as your daily dose of folic acid will help to prevent all kinds of life-altering birth defects for the child. And so if it's an unplanned pregnancy, you can be into the end of your first trimester before you even know that your child is at risk. And by the 4th or 5th month, they're able to detect everything that could possibly go wrong with this pregnancy, where if, as much as possible, if it's a planned pregnancy and you're having this conversation with your OB prior to the pregnancy, then you can prevent some of those things that are preventable. Now, in terms of the route to do that, I'll trust my sisters to give the expertise on that, because I don't know. All of my children were surprises. So if I knew then what I know now, right.
I guess that would be me. So I would say, as you start, build your team and start with your doula, because your doula will then help you to figure out if you want a midwife, a OB, do you want a home birth, do you want a hospital birth, a birthing center. Your doula can really help you to map that out, to start to build your team. And when you're picking your doula, I always say, like, do your interviews. And one thing I like to leave my moms with is you'll know your doula the moment you meet her, because you'll feel it. You won't have to do any shopping. There will just be that something that you know will be her. And if you can trust her and you fall on that intuition, she will help you build your team from there.
I would also say, as soon as possible, when it comes down to preparing, a lot of people have surprise babies. I don't know the percentage, but I'm pretty sure it's more than half. People are not necessarily planning to be pregnant and get pregnant. So being able to understand your balance with your diets and the practices that you take or have throughout your life is number one. So if you know that you want to have children, working on those. And of course, that's something that we all work through throughout our lives, and we learn through our experiences. But if you know that you want to have children, working on having a balanced diet and a balanced mental health practice and a mental health load. And that's not just for the people carrying the baby. It's also for the men. So men, fathers in here, your diet has a lot to do with the health of the pregnancy and the health of that baby. The men's biological makeup is what contributes to the placenta, and that is where the baby is being fed all of its nutrients throughout the pregnancy. So your health is very important. It's extremely important. And then also men's age has a lot to do with the health of the pregnancy that the woman is experiencing. So before getting pregnant and before, as men, you don't get pregnant, but before even considering being pregnant, checking into your diets and things. But then also, as soon as you know, and as soon as you're comfortable to tell somebody, leaning into your support systems, whether it be a doula, whether it be your sister, your auntie, your best friend, and finding your pediatrician through the people who you love in your circle. You know people who have children. Find out what their pediatrician is like. If they just happen to have a pediatrician that they go to, but they don't necessarily know or like, then maybe that's a good way to say, okay, maybe I won't necessarily go to that person. But leaning into your support system to be able to build your team including your doula and your midwife and your OB and pediatrician that come from that.
I'm just going to add that, of course, you want to find your provider as soon as possible, but don't be afraid to change your provider either. If you talk to your provider and you express what kind of birth you want or what you want for your pregnancy, and they're giving you pushback and they're not explaining or willing to listen to you, if you don't feel safe with your provider, you need to change before you come into labor and delivery, because at that point, it's too late. And let's say if you want someone who doesn't want to do unnecessary inductions and they have a very high induction rate, you might need to find a different provider. Additionally, you want to ask them if they support unmedicated birth, if that's what your goal is. Are they going to make you stay in bed the entire time? Are they going to allow mobility? Are they going to deliver in the location you want to deliver? Do they have a high cesarean rate? You want to interview them just like you would interview any other person you are hiring to help you through a project. This is your health care. You are the consumer, so you get to choose who's taking care of you. So if your provider doesn't align with you, you don't be afraid to change. It'll probably make a difference in your birth experience.
In regards to choosing your pediatrician, I would recommend somewhere between the 6th and 8th month at the latest. You definitely want to go in and, as my good soror said, ask questions. That time will indicate, are they going to take time to answer the questions that I have? Are they going to listen to my concerns? Are they going to dismiss me? I get so many patients in today that are, number one, changing their providers, and number two, I'm like, who told y'all to do that? And I have to go back, because there are some things that are cultural, right? And there are some things that are medical. But we need to find someone who understands both aspects of us as clients and as caregivers and as providers. And because I find myself more often than not, like, telling newborns, like, put some lotion on the baby. It's because they walk around, well, they told me not to put that on. Who said that? And so you really need to be able to ask the questions and have someone that will take the time to answer all the questions that you have. And interviewing prior to will give you that opportunity.
And I'll just piggyback off of everyone else. It is very important to find your providers early. I'll speak on the financial piece of it. Insurance companies view home birth midwives, or the majority of them, as a luxury service and therefore will not cover it. And I've had many people reach out toward the end of their pregnancy thinking that they can just come into care and insurance is going to cover the bill, and that is not the case. So finding your provider early gives you time to, one, save money. If you're having a baby shower, you can request a payment for services as a gift instead of physical gifts or in addition to. But it also gives you time to actually research the kind of provider you want for your birth, and not being forced. Like, if you really want a home birth, but you don't necessarily like the midwife, but this is all that's available, reaching out earlier allows you the time to actually make the important choices for yourself.
That's so important. I love that. So how can families, because we always talk about the client, right? But what is some advice that you give to families in terms of how they can support someone who's pregnant or going through this process?
Sometimes when you're in labor or even for your prenatal care, you don't feel comfortable speaking up. And if you see the person you're supporting needing help, or you're seeing concerning symptoms, you can be their voice and speak up for them. If it's very intimidating in prenatal care, it's very intimidating in labor and delivery, and you're usually scared if you're the patient. But if you are the husband, the partner, the friend, the mom, the sister, and you see, like, hey, this isn't normal. This isn't how she normally acts. This symptom isn't what I experience. Is this okay? You can ask the questions and be their advocate.
Go to the doctor appointments. I think that's very important. We have a high military presence in the area, and so I was providing support for a family where the husband was out to sea serving his country, and so the brother came to every visit, and so he got all the information about what a healthy pregnancy was supposed to look like. And so he was able to identify signs like moms. I can't speak for any other community, but in our community, you all suffer under the myth of the strong black woman. It's unfair and it's unhealthy. And you take a lot and you take on a lot. And we would not be where we are without you doing that, but it's killing you, right? And so you need people in your circle who are going to advocate for you, who are going to say, no, don't do that, don't go there. Sometimes don't eat that, sometimes put that down. At the last doctor's appointment, the doctor said to watch out for this, and I've noticed this, and I've noticed that. And like my sister said here, to really have somebody that will advocate for you, because you also, in addition to dealing with the myth of the strong black woman, you deal with the myth of the angry black woman. And so it's not always comfortable or safe. Experience has taught you to not speak up and to monitor your tone, but your child's life is on the line, and often your life is on the line. And so if your instincts say that it's not safe for you to speak up, then you absolutely need somebody who is going to speak up for you, who knows. For the fatherhood program that we ran, we had a doula help us develop everything. There's so much that we learned so that we could use to help our fathers to advocate. And so if you have a medical professional that you trust, that can give you the information, that can give you the ins and out, that you can share with your family if they're not present, that's going to be very helpful for you during the pregnancy.
I'll just say I'm not from here. I'm an Army vet. And so when we talk about family, most of the people that I consider my family aren't really my blood family. And I think that's really important, especially when we talk about a village that we need to help us raise our children, right? We need a village. We can't do this on our own. And I'm not even from here, right? So, but a lot of these people I consider like my sisters. So I think that you also have to be out in the community. You can't find people sitting in your house. Some of you may not be from here, so you're like, man, I don't really have any family, but God sends you people. He sends you people in different shapes, different forms. You may meet your sister in the grocery store, and you bumped into her, and y'all just say, oh, my bad, and keep walking. But nah, that was who was supposed to be supporting you on your journey. So when we just talk about family, I just like to tell people to keep their eye open. It doesn't always have to be someone that is actually close to you in your family. And even me, when I was going through my pregnancy journey, I didn't even like my family because I'm from the South, and they like, no, we're not breastfeeding. You know what I'm saying? You don't need to be walking. Like all these just stuff, I just be like, what? Like I had to stop talking to them. And so, yeah, just leaning on people and trusting God that he will send you the right people in your life, especially if you don't have that quote-unquote family.
I would say that the biggest way that family can support clients or their family members is just by supporting them in their decisions. Lots of times when people talk about childbirth or their pregnancy experiences, they give you more of the negative than they give you the positive. And pregnancy and childbirth is, I think, more mental than it is physical sometimes. And if you're going into it with a bunch of negative thoughts and negative opinions, it can affect how you actually deliver your baby. So just respect what their thoughts and opinions are, because at the end of the day, they're becoming a mother. If they are a mother, I always say the best gift you can give for yourself is to advocate for yourself, but you shouldn't have to fight to do that in your own family.
Sometimes blood family is not what you need, especially if your family is toxic. So it might be your chosen family that is the village that you build. So everybody isn't blessed with a healthy family, but you should be blessed with a good chosen family. So in what ways are community-based initiatives and grassroots organizations contributing to improving our maternal health outcomes? And I want you, if you know a really good one, shout it out so that our community will know about them as well.
I would say things like this, events like this, And unfortunately, these things start happening mostly in the spring through the summer. So we're going to work on hopefully getting more things that are family based. And I'm not saying you all, I'm just saying in general, as a community, I believe that we're all going to come together and have more. But stuff, events like this are popping up all around the Hampton Roads area. And there, I didn't work here. I live here. I'm new living here. But there are other organizations that are perinatal support organizations that support you from conception through postpartum, connecting you to Medicaid resources if that's what you need, as well as other events such as this and basically creating a brochure. I am pulling together a lot of the resources in this area because there aren't many places where you can find, there aren't many one-stop shops where you can find all of the resources, and I'm doing so on thevillage.birthworker.com, where you can all go and find these resources, whether they're free or not. I'm not charging for them, but they're in this area, this general area.
Can you repeat that website, please?
Yes, thevillage.birthworker.com, and it's under resources and under Hampton Roads resources. And Atlanta is there, but eventually Atlanta will be phased out because I'm here. And yeah, for the most part, community organizations, community events like this, organizations such as this, going to local doula and birth worker websites, try to list resources, and also the NAABB.com, which is the national, it's for the advancement of Black birth. I don't want to lie and say what the acronym is and have it wrong. But they do it also regionally, where you can find organizations and events in your area, and then you would put in this area.
It's the National Association for the Advancement of Black Birth, so it's NAABB.org. That's where that Black Birth and Bill of Rights came from that y'all saw. Okay.
I like to say that the community events, and I guess I'll shout out myself, Mother Baby Wellness Centers, because what we do once a quarter is have Mother Blessing Ways, where we get together and we offer chiropractic care, massage therapy, we do yoga, we do meditation, and we do acupressure that we offer to the moms, and it's a time for you to come and get those services. And we also have resources there as well. So the next one we're having is in July at Mount Sinai Church in Newport News. We'll be offering all of those different services, and then we'll have resources. Also, the Doula Association will be doing prenatal yoga on Saturdays at 1700 Portsmouth Boulevard, and you could go on the website, the Doula Association of Virginia.org, sorry, and the schedule for the prenatal yoga will be up there too.
Listen, I'm going to shout myself out. So every first Saturday of the month, we get together with the moms and the kids. I am also a life coach, and I take the work of mothers very seriously. I think that you don't just have to watch your child blossom, that you can blossom with your children. We can all grow together. I think that's also why God gives us children, not for us to be stagnant and watch them. That kind of seems weird to me. So every first Saturday of the month, so next Saturday, we get together at 1700 Portsmouth Boulevard. I hope I'm saying that right. And we get together and we work. We do the hard work. Who are you? What do you like to do? What keeps you up at night? Why are you crying? Why aren't you crying? All those questions that you don't really want to talk to anybody about, that you kind of keep to yourself, we talk about those. We get together and we have honest conversations. It's just the mothers and their children. Sorry, dads. He got something down there for the dads. But we just get together and I take it very seriously. I pray that everyone that comes grows. And it's hard work, right? It's hard work when we just sit down and say, who are we? But it's necessary. Don't go in that dark hole. Don't go in that dark room. You can come out. You can come out with your children, and it's beautiful too. Oh, and so yeah, Mom Men's every first Saturday. I said that right? Okay.
So there's a couple of organizations I want to shout out that are doing good work in the community. The first is the Up Center. So the Up Center got a grant, I believe it was through Anthem, correct? And the grant was designed to impact maternal health outcomes for Black and brown families, which we're no longer allowed to say out loud because of DI stuff, but that's what it is. That's who it's impacting. And the way they did it a targeted approach through supporting fathers so that fathers could support the mothers. And so we actually have 2 dad engagement specialists in the back of the room. Mel, wave your hand. And I saw Brandon, but I don't. And Brandon had to exit. And so they have groups that they do to support fathers who are expecting, is it up to age 3? Fathers who are expecting up to age 3. It's free. The entire 757 is still covering. And so they're doing good work, making sure that the fathers are educated on what the moms are experiencing going through the birthing process. Our curriculum was designed by a doula. It's so specific that we're able to prepare the animals for the child coming into the home, because when a child comes into the home, it's a blessing, but it's a disruption to the house. Everything changes when, what to do with the other children, how the dads can engage. I do want to say this. Childbirth, child rearing is not woman's work. I mean, y'all know that already, but it's not woman's work, right? It's a family thing. Unless you're the Virgin Mary or you're doing in vitro, typically there's a male involved, right? But we don't socialize our boys. They're not pushing shopping carts. They're not doing the ironing. They don't have the kitchens, right? And then on all of his laundry, right? And then he's expected to know how to be a father, which that's not how life works. It's not how it works. And then we'll have, not an event like this because their dad's here, but most baby showers are not co-ed. So the husband is not really involved in the planning of the wedding, except paying for stuff. And the husband's not involved in the baby shower, except for paying for stuff, okay? Except for paying for stuff. And that does not foster a healthy relationship, right? And so we have to do more, and that's why you have your dad engagement specialist. We have to do more to integrate the father into the process as early as possible. And there are even health outcomes that are improved. Improved by father engagement because moms and dads play with their children differently. There's psychological benefits to the way fathers play with their children. And so if you are expecting a child, maybe dad's not present, maybe dad's overseas, maybe dad's away in college, AKA jail, doesn't matter. You got a brother, you got an uncle, you got a grandfather, you got a godfather, you got a baby cousin, just some other influence that can be supportive and educated in this process. Please contact the Up Center. It is free. It's amazing. And then we have our own Doctor of Nursing, certified nurse, midwife. Do I have all the titles? It's a couple of other degrees. Because she doesn't brag, so I have to sneak and look at her wall. And her space is, it's not exclusive, but it's very inclusive for people who look like us. Black women feel safe in this space, and that's what we need, a safe space. Reach across, I apologize. Ms. Nicole, she's the real deal. A Jambi birthing wellness, so that's pretty good, because I'm tired. I was ready to mess it up. So I strongly recommend, and she's about that work. Like we're creating partnerships through reentry. She's just a part of a lot of good work that is going to support birthing families. So I recommend anything that she's a part of and anything that the Up Center is doing related to their certified parent educators, their dad engagement specialists. And for the Up Center, those are free resources. Okay, sorry.
Okay, so I just want to take a moment. If you are in this room and you are not pregnant, but you are here supporting someone that is pregnant, we want to say thank you. We have to give you your flowers because it's not always, like I said, we have our patients, but it's the families that support them. It's the people who show up for them, who listen to them, support their decisions, and say, okay, that's what you want to do? Well, we're going to ride with you then. We're just going to support you. All right. In the interest of time, because we want to be able to open this up for questions, if you had one piece of advice for our birthing families, what would you say? Just one quick piece of advice. Everybody.
Ask for help.
Stand your ground.
Don't be afraid to speak up for yourself.
What they said.
I think I would say ground into your pregnancy. You will never have this moment again. 8 babies, no pregnancy was the same. Each one was different, and this is the time to really transform your life. And if there is something that like you want to do or accomplish or some goals and changing yourself, this is the time.
Lean into your intuition. You know best for yourself. You know when things are off, and then this isn't just the pregnant person. This is the family. Lean into your intuition. When something is off, address it. Talk amongst those people you trust if you feel like you need to talk it out loud, and talk to each other, build each other up. Lean into yourself, into your intuition.
And I'll just say silence, pray, and get to know you.
All right. Do y'all have questions? Well, first of all, let me just say thank y'all because this is an amazing group of people. Are there questions that you have? Oh, wait, hold on. Y'all got to get these mics or something. Who has a question?
I do. Okay, a quick question. I find that I'm expecting, I'm unemployed. What should I do and where should I go?
Don't be afraid of Medicaid. You get your resources as early as possible, and get as much as you need. Don't be afraid to say what it is that you need. And then talk to, if you have, hopefully everyone has a trusted healthcare provider. Tell them, say, look, this is I'm pregnant and I don't have a job and I want to stay healthy. I want this to be a healthy pregnancy. What is there that's out there for me? And then, well, I'll leave that part.
So dial 211. 211 is your resource guide. You dial it, you give them your information, and they will plug you into all of the resources that are in the state, whether it's getting Medicaid, getting EBT, SNAP, WIC, all of those things. These resources are available to you. I feel like if you ever worked in your life and you paid some taxes, get your tax money back. Get that Medicaid. It's okay. all of these managed care organizations under Medicaid have all of these benefits. Some of them offer meals, some of them offer phones, some of them offer all these things. Get your benefits, and do not be afraid of getting those benefits.
Hello. Okay. So I'm a vendor here, but speaking to what Jazz was saying about the financial, I have more of a comment. The financial aspect, we understand that having birth work support outside of what your insurance covers can sometimes be a financial burden. There's an amazing website called Little Honey Money. If you have not heard of it, it is a website strictly for moms where you can set up either the cost of your doula, the cost of your midwife, chiropractic body care. You can set the price on the website, and people can donate toward whatever that total cost is. So if you're not looking to pay for something out of pocket, if it's a diaper registry, again, anything that is solely mommy related, it is an amazing website, and then whatever money is donated into that account goes straight into your bank account. I went 8 months and I didn't pay for diapers because I put my diaper registry on Little Honey Money. I had the cost of my doula covered through Little Honey Money. And it changes the narrative around what care looks like for you, because everything isn't just baby related. Now it changes the focus to I need care too. Okay, I'm also a breastfeeding peer counselor with WIC. If you do not have WIC, please sign up. If you have Medicaid and if you're on EBT, you're almost guaranteed to have a WIC account. Okay, that's it. All right.
Can you say the website one more time?
Yes, Little Honey Money. So it's spelled out the way that it is. LITTLEHONEY, money, MONEY. It's really easy to set up. You don't need a whole lot of things. But if you want to put date nights, your kids' college fund, I put getting my nails done on there because that was important for me after I had that baby. People can pay into whatever it is you want in postpartum.
Thank you.
Akila.
Yeah, she got one right there.
I just have a couple of questions. My name is Sierra. Okay, a situation. You had 3 cesareans, but you want to have a vaginal birth, and it's been 8 years since you had your last child. Is that possible? And if you are considered high risk?
So I'm going to say, as a midwife, I would not take you and do a home birth with you because I would feel it's irresponsible for me to do that. However, I would refer you to EVMS where they do high-risk care so that you can have a conversation with them about it. But it's more than just saying, I had 3 C-sections and I want to have a VBAC. The question is, why did you have these C-sections? What was, the information behind it, what the risks are? But that would be the place that I would send you. But I would not say, oh, yeah, we could do this at home. Because if there's an emergency, we got to get to the next level of care. So that's my answer on that.
And I'll also add, even if you don't have your baby at home, you can still do out-of-hospital prenatal care. That way you can still get all the education, all the loving, all the one-on-one time that can help prepare you for that hospital birth. And then you can also return back to that midwife for postpartum care.
Now, what's the difference between a midwife and, and a doula?
The midwife is the medical provider, so we're the ones that actually provide the care and deliver your babies. Okay. And doulas are more so the support, so educational, physical, just emotional support.
Okay. All right. Thank you.
Hello, everyone. No question for you guys, but I just wanted to give, praise to you because as currently, pregnant mom with a baby on the way, you guys are telling us to advocate for ourselves. And sometimes us as patients, we do, get nervous or scared or don't want to annoy you guys as providers to, advocate for ourselves. So it's just very refreshing for you guys to say, speak up if you think something is wrong and, don't take no for an answer. And you guys are telling us, just other avenues and different questions and stuff to ask. So I just want to applaud to you and keep advocating and telling us that because we can, be scared to advocate for ourselves at times.
I want to just say thank you for that. That culturally congruent care is important. When you walk in the room and you see somebody who looks like you, then y'all know we code switch. Y'all know we show up and we do not show up as who we truly are, but we'll give the representative of who we are because we don't feel like what we need to say is going to be important. But like she said, you know that you can speak for yourself, and you got providers and other people who are going to say, well, what is it that you want? Right? I'm not going to tell you what you need. You know what you need. I don't know what you need. You got to tell me. Other question. Oh, go ahead.
I just want to say, y'all, be honest. I see you all after you have had the baby, and there's a questionnaire that you all probably have all filled out after birth, at the 4-week visit, at the 2-month visit, at the 4-month visit, because I see y'all all the time, right? For a whole year, y'all bringing these babies in, and we're asking you questions. Do you laugh as much as you used to? Do you cry more than you used to? Do you feel enjoyment doing the things that you used to do? Be honest when you're asking or when you're answering those questions so that we can provide you with the resources that you need. Are you sleeping? Are you eating? These things, especially if you're breastfeeding your baby, if you do not take care of yourself, you cannot take care of your family. And I tell people all the time, y'all sleep when that baby sleep. Don't try and do everything when the baby is asleep, because when the baby wake up, now what you gonna do, right? Take care of yourself and let people help you. Let people hold the baby. Let people feed the baby. Let people take care of the baby so that you can take care of yourself. It is okay to ask for help. And just please, please, please be honest.
You are your number one star player. If you don't take care of yourself, you can't take care of anybody else. And it's not even about just postpartum depression. People don't even realize that anxiety, postpartum anxiety is real. We don't talk about it. Post-traumatic stress disorder, you've had a traumatic experience at that birth that stays with you. And and it makes you anxious and hyper vigilant, and you're watching the baby breathing. You're like, well, why can't I not stop making sure that something is going to be wrong with my child? I think one lady said that she wouldn't have her baby in the back and roll the windows down for fear that the baby's going to fly out the window. And it's not realistically, the baby's not going to fly out of the window, but in her mind, that was a very real fear and a very serious concern. But it shows up in many different ways, not just sadness.
I tell people that what you're experiencing, this is the result of implicit bias, because other communities aren't afraid to ask for what they need. How many patients come to me and said, oh, I didn't want to say anything because I didn't want to bother you. I didn't want to be a problem, because we're afraid that we're going to be judged for advocating for ourselves. But this is what's leading to us having bad outcomes, because we're going to delay care when things could have been prevented. So if you feel like you're being a bother to your provider, then you need to change, because you need to take care of yourself and you need to be the priority.
I'd just like to add that when it goes untreated, it stays in the body. It stores in the body. And this is where you have back pain. This is where you have shoulder pain. This is how you get cancer. This is how you get diabetes. So it's not just that moment, right? And not only that, if you're looking to have more children, it affects more children. And ladies, I can tell you that if it's not taken care of, baby, it's going to show up in postpartum. It's going to show up in menopause. It's coming back. So just go ahead and deal with it, and just deal with it so that you can rid of it and know how to compartmentalize that.
Go ahead.
I just want to give 2 small bits of unsolicited advice. Number 1, give your partner, your male partner, permission to be scared of the process, and give him permission to be ignorant of the process, right? So hypermasculinity, toxic masculinity, in our community, it has physical effects, mental health effects on us. We're expected to be protectors and providers, right? But let somebody call the police and they swat my house. If I have a legally owned firearm in the house, I'm still getting shot. Like, it doesn't matter. Like, we know that we're not safe a lot of places outside the house. We carry that. And so we need to know that it's okay to be scared, to not know what we're doing, to experience anxiety. If you give us that, if you tell us it's okay, if you give us that freedom, if you're already attentive, you already know. Say it out loud. The second thing is, there are women who choose to be unmarried parents. It's a choice. They choose to. They didn't get left. They didn't pick a bad man. They choose to. We have to be careful about our language from women to women about being a single parent. There are women who want to have a baby, and they are perfectly capable of doing it by themselves. So we have to be careful with our language in that area. We also have to be careful with our language for our brothers and sisters in the LGBT community, right? Because you already know, if you're black and you're a woman and you're gay and your partner shows up and it's a woman, you're going to get treated differently in the hospital because there's so many, the intersection for women, racism, it's there, right? So you have to be careful with that. And then we also have our brothers now who were born women and transition but still want to have children. And we need to create space for them as well, because that can be a traumatic birthing experience. And so we have to be very mindful about the language that we use, the things that we say, so that we're not creating an environment where people aren't sharing. And from experience, I had to stop telling my daughter that I would kill somebody if they sexually assaulted her. Because then one day she told me she wouldn't tell me. Well, why wouldn't you tell me? Because I don't want you to go. And so I left her unprotected for 4 years. I had been saying this. Had something happened to her, I had created an environment where she didn't feel comfortable talking. And that's the worst thing that I could do as a father, is create a space in my effort to protect her, or in other areas joking. So we have to be very, you already have enough on your plate, right? Your sisters already have enough on your plate. We have to be mindful about what we say publicly and privately, the jokes that we tell, these interactions that we have, because we do not, I said this at a meeting with the Up Center and some of their more fair-skinned funders. One dead baby is one too many, right? And that's what this is about. And they took it to heart. At board of directors meeting, I just said it, right? Because I'm the token, so I'm going to walk in it. That's what I was. I was a token black guy there. And that was fine, because I used it. So we have to, so our language is very powerful. So those are 2 pieces of unsolicited advice.
Can we get that question in the back?
Okay, so I have a question about baby acid reflux. Is there something that, because me and my girlfriend, we be scared when she has a reflex. Is there something that we can do?
So the simple answer is yes. Whenever you have, especially a newborn baby or a young baby, we want you to implement what we call reflux precautions, right? So first thing you have to do when you're burping the baby, the questions I would ask is, how often are you burping the baby? If the baby is breastfeeding, you want to burp them at least every 5 minutes. If the baby is bottle feeding, you want to burp them at least every half an ounce to an ounce. Sometimes people get in the habit, well, I'll just burp the baby at the end. But the air is coming out whether the milk is in front of it or behind it. So if the air is below, the bubble is below the food, then everything's coming up with the bubble, okay? So frequent burping is number 1. Number 2, what you want to do is make sure you try to keep the baby upright for a minimum of 30 minutes after each feeding. So I know they get sleepy and they want to just fall over, but you want to keep them upright, because that little torso, right, there's no room for the bubble to go. And the bubble's coming out, right? I'm going to say that like 5 more times. The bubble's coming out, okay? So if you lay them down and that bubble is in there, then they're going to tip over. The other thing that I would recommend as well, if you have one of those little vibrating chairs, if you are awake, you can't be asleep and put the baby in there, okay? If you have one of those little vibrating chairs, maybe a little jiggle, okay? That'll help get the bubble out as well. After you have burped them frequently, you left them sitting upright for 30 minutes, and then you put them in the vibrating chair. If they're still uncomfortable, you can put a warm washcloth on their belly. So put a washcloth in the dryer. It's like a little baby heating pad. Put that on that belly, help move that gas on out, okay? And then you can lay them across your lap, kind of jiggle your legs a little bit, okay? Now, you want their head kind of over the edge or they're going to vomit all over you. But you got to get that bubble out. Shake them up a little bit, okay? After you do all that and you still have issues, then there are things that we can talk about. What are the types of, if you're breastfeeding, what types of foods are you eating? If you're eating collard greens and red beans and rice, then the baby going to have gas, right? It's to be expected. No matter, you can do all of those things. If you are having a type of formula that perhaps maybe the baby has a milk protein sensitivity or an allergy, right? Then we need to talk about what other things do we need to do. Is the baby rashy? Are they also having diarrhea? There are so many things that it could lead down. But step one, the answer is implement the reflux precautions, okay? But you want to be able to go to somebody that will give you all of those options.
All right. I know they're looking at me saying it's time. So with that being said, I just want to say thank you to everybody who showed up for this panel. And I'm going to ask them to just sit there for a few minutes. So if you all have questions, would like to get their contact information, interact with them, they'll sit here for you to do that. But thank y'all.